Hi everyone, my name is Abiodun. Um, Today I'm going to be talking about prostate cancer in men, and I'm going to be focusing on the African American population. But before I dive into this, I would like to give a brief background of myself. I studied pharmacy in Lagos, Nigeria. That's in Africa, and I worked as a pharmacist for over 2 years. And in this period, I was able to interact with a lot of patients. I was able to educate a lot of patients on different diseases such as HIV, AIDS, cancer. And I'm happy to be here today to continue with the education. And in this case, it's going to be on prostate cancer. So I'm just going to move to the next slide here. So this presentation is actually focusing on the women in the men's life. So we know that sometimes men can be they can be a bit hesitant to talk about treatments, especially when it has to do with sensitive areas. For example, the prostate. So we want to talk about what we as women can do to help the men in our lives. So I'm going to just give a brief introduction of prostate cancer, how to detect prostate cancer, the treatment and clinical trials available for prostate cancer. Okay. So first of all, I'll just give a brief introduction here. So prostate cancer is a cancer that occurs in the prostate. The prostate can be found just above the urethra, and it's a walnut-shaped gland. Its secretion is what makes up the seminal fluid, and it is positioned very closely to the nerves and the blood vessels that supply the penis for erectile function. Sorry about that. And how common is this form of cancer? Usually, cancers can be benign or metastatic. If the cancer, which is an abnormal growth, is benign in the prostate, surgery can be performed to just remove the benign growth. But when it becomes metastatic, this means that the cancer has transferred to other parts of the body. And this is when the cancer becomes more aggressive and would need chemotherapy and other forms of treatments. So how common is prostate cancer in the world generally and in American men, I mean? It is one of the most common cancers in American men. And the American Cancer Society estimates that there are about 248,000 new cases of prostate cancer yearly, and about 34,000 die from prostate cancer. Now, specifically focusing on Black men are more likely to be diagnosed with prostate cancer and nearly 2.5 times more likely to die of the disease compared to non-Hispanic white men. And this is why this presentation is important, because we need to educate ourselves as Black men and women on how to make sure our men are healthy. So the first step that we can help reduce these numbers, especially in the Black population, is detection. How do you detect prostate cancer? So there are two clinical ways to detect prostate cancer, and there are two risk factors to consider. So I'll start with the clinical ways. The first one is a digital rectal exam. This is a physical exam that involves the doctor using their fingers to reach to the prostate gland, to feel the prostate gland for any abnormal growth. And this type of exam, although it's a bit invasive, it is for the good of the men in your lives, because This is one of the most effective ways to detect if there's any abnormal growth in the prostate. And it doesn't take time. It takes less than 30 minutes, and it can be done and usually they recommend for this exam to be done every 2 to 3 years. So it's just 30 minutes in 2 years that could save your life. So I would advise you, if you can talk to your partners, if you can talk to the men in your life, to go to the doctor to do this exam for 30 minutes, and they'll know more about their prostate health. Another clinical exam done is this prostate specific antigen exam. This is a laboratory test where the prostate we're going to try, the doctors try to detect if there is a prostate specific, the doctor tries to detect the prostate specific antigen levels in the body. And there is a certain mark that patients are not supposed to pass over. Usually, if you pass over that certain mark, that's when the doctor would be more worried and they would have to run for that test to actually see if the patients have prostate cancer. But usually, if the prostate specific antigen levels is low in the body, you don't even have, the doctor might even recommend that you don't have to come in every 2 to 3 years. It might be longer, it might be 5 years. So the prostate specific antigen levels is really important too. Then the two major risk factors is family history and ethnic background. So family history, if there's someone in the family that has had prostate cancer before, the likelihood of another person in the family having prostate cancer is higher compared to a family with no prostate cancer. So for example, if the father had prostate cancer, the child, once the child gets to the age of 40 and is an adult, we would recommend that the child goes for prostate cancer screening every 2 to 3 years. Then the ethnic background, as I mentioned in the previous slides, Black people are more likely to be diagnosed with prostate cancer and to die of prostate cancer. So being Black alone is already a risk factor. And this is why what we're doing here today is important. So there are many treatments available for prostate cancers. There's chemotherapy. There are different types of chemotherapy medications that could be used. But one thing we want to actually talk about today is clinical trials. So I'll give a brief introduction on what clinical trials are, their importance, and the different clinical trials going on for prostate cancer right now. So clinical trials, they are research studies that involve people, and through clinical trials, doctors can find new ways to improve treatment and quality of lives for people with certain diseases. Clinical trials can be used to come up with medications and treatments that treat cancers, that prevent cancers, or manage the symptoms and side effects of the treatment of cancers. And the clinical trials are the final step in a long process in developing these treatments, which usually starts with research in the lab. Before any new treatment is used on people, researchers work for many, many years to understand its effect on the cancer cells, the cancer cells in the lab, and they test it on animals before coming to human beings. And they also try to figure out the side effects it may cause before testing in human beings. So this shows that a lot of work is put into developing treatments before bringing it to human beings for testing. So trials are available for all stages of cancers. And there's a popular myth that says that it's only for people with advanced cancers. Actually, cancer trials can be used, any patients in any stage of cancer can enroll in clinical trials. So here, I'm just going to give the brief phases of the clinical trials. Phase 1 is the phase where the drugs are tested on healthy individuals. And here we just test for the safety, the dosage, and the side effects. Phase 2, we get a larger group of individuals and we test on the efficacy and the side effects. Then for phase 3, we expand the demographic, and apart from just testing for the efficacy and side effects, we look into long-term effectiveness and we compare it to existing treatments available for the particular type of cancer that is being worked on. Then after phase 3, the medication or the treatment goes through FDA approval. And once it's determined safe for public use, it is released to people to use for treatment, and clinical trials would still continue in phase 4. You continue testing for effectiveness and safety just to make sure the drug is safe for anyone. And if anything comes up, it can be taken off the market as soon as possible if necessary. So a lot of people actually have fears that prevent them from enrolling in clinical trials. And I was able to do some research, and I was able to find this systematic reviewing the factors that actually dissuade people from going into clinical trials. So as you can see in this graph, the main factor is education. So lack of education on clinical trials. A lot of people don't want to go into clinical trials because they don't have enough education about how the clinical trials process is, what the point of clinical trials is, and how safe clinical trials are. So education is one of the most important factors. Also here, you can see mistrust and costs are other high factors. In the mistrust aspect, people might feel like enrolling into clinical trials might be that they are acting as guinea pigs for big scientific corporations. That is not it. Clinical trials involve the smartest, the most experienced doctors and physicians and healthcare professionals. All we are trying to achieve with clinical trials is to come up with treatments that would actually provide a better quality of life to different people, regardless of their race, regardless of their ethnic background. So it's a teamwork effort between the patients, the doctors, the physicians, the healthcare workers, and the pharmaceutical companies coming together to make sure patients get a better quality of life. Cost. Although people worry about cost of clinical trials, actually most clinical trials are covered. Most clinical trials are covered either by the pharmaceutical companies or your medical insurance. And one thing at Hail Mary is that we can help you find clinical trials where you don't have to pay anything, where you just have to show up and you don't have to pay any costs for the trials. One last factor I would like to talk about is the provider attitudes. So for example, some people might go to their physicians and might talk to their physicians about enrolling in a clinical trial, and their physicians may want more information about the trial before they recommend you to go for that trial. One thing at Hail Mary we are trying to also do is also provide enough information for the patients that they can take to their physicians so that their physicians can have a positive attitude towards the clinical trial and know that the clinical trial is for the good of the patient. So right now, there are so many trials going on for prostate cancer treatments. For example, there are targeted drug therapies. This is the development of actual active ingredients that would stop the growth of that would stop the growth, the abnormal growth of cells in the prostate. And for example, they're working on the monoclonal antibodies and the PARP inhibitors. Then there is also immunotherapy. This focuses on the prostate specific antigen. So there are vaccines working on this. They are developing vaccines for this, immune checkpoint inhibitors, chimeric antigen receptor T cell therapy also. Then the last one is hormone therapy. This is just done to reduce the hormone that causes with hormone therapy, their aim is to reduce the hormone causing the abnormal growth in the prostate. If you'd like to learn more about these different clinical trials, please feel free to reach out to us at healmaryapp.com, and we'll be happy to answer any questions, and we'll be able to link you to the specific clinical trial that fits your situation better. So I'm just going to stop here for today. I hope I've been able to shed some more light about prostate cancers and the treatments and the clinical trials available. Please let me know if you have any questions. You can forward it to healmaryapp.com. You'll be able to see our contact information there, and have a nice day. Thank you.